Okay, so how can you take yours off your face without going under the knife? Well, we're going to show you how. I'd like to welcome Dr. Melanie Palm from The Art of Skin to Primetime. Welcome to Primetime.
Good to see you again, Taylor.
So tell us how you do this, because, you know, about in the 30s, the skin starts to get more, you know, a little loose. Wrinkles start to show up.
So you're exactly right. So a lot that I talk to patients about non-invasive ways of us sort of improving the look of the skin and our overall visage on our face is about relaxation. We do that with things like Botox and Dysport, resurfacing if it's necessary, but then revolumizing we're going to talk about, and also lifting as well. So in that case, we're actually going to talk about a couple of different items today. So we'll get kind of to the first one, which is something called Sculptra. It's kind of been a sleeper filler. It's been around for quite a while. It's been around in the United States since 2004, and it's a milk sugar. It's polyl-lactic acid, same ingredient as what actually absorbable sutures are made out of, and it comes as this little powder form that then gets reconstituted, and we do it over a series of treatments all over the face to kind of globally revolumize the face, and it causes
so it's a plumper.
It is, and it causes, the way it works is it causes your own body to build collagen in its place. So it's really gradual and kind of subtle over time. It's not something that's sort of immediate change, so people are sort of inspecting you and wondering if you got something done.
So it's something that is permanent, though.
Well, it's longer term, so it's FDA approved for 2 years, but why I also like it is we notice as physicians that do a lot of Sculptra that patients often have skin textural changes for the better when we use Sculptra, because it builds the dermis of the skin.
That would also help people who have bad acne, cystic acne, and they get the pox.
Yeah, it's been written about for that and for scars, as well as other applications on the skin.
So what else do you have over there?
So then we
that
also
looks like
have,
an ink cartridge.
It does. These are transducers that go with something called Ultherapy. We just brought the actual hand piece today, but this is ultrasound technology. So actually what we use when we're checking out the status of a baby developing in mom, they harness this energy and focus it on some of the deeper layers of the skin to be able to tighten it over time and also build a little bit of collagen. So it's used as a non-surgical brow lift, non-surgical face lift, as well as a non-surgical neck lift. And I
Does it really work on neck? I heard nothing works on neck.
It does. Neck is the really tough place. I tell patients that sometimes the giveaway is the neck, the décolletage, and the back of the hands.
Don't look at my neck.
And so, but it does. You know, I tell patients I hope for about 50 to 60% improvement as far as comparing that to surgical interventions. But if you use it with some maintenance, it really does help.
Is this somebody who had Ulthera?
This is somebody that was Sculptra, so younger patient. You can see she's starting to lose some volume, and that's a before and after. Just her cheek looks nice and pretty and continuous. It almost turns
right
back
here with the eyes that kind of get saggy. Now it looks youthful again. So can you do Ulthera, go back to Ulthera? Can we use that anywhere? Can you, I know it's the face, but could you do, because women get saggy everywhere.
Yeah, so there's been a small clinical study using it on the arms, using it on the knees, and they're actually developing a new transducer that would be used on the body. So we'll probably have new applications for it coming in the future.
Okay, now look at me real quick and tell me what you could do, what you would do to make me look younger.
Well, first of all, you're beautiful, and I preface that.
I have thick skin, but what would you do?
But you've got really pretty bone structure, but like all of us, starting around 30, we lose a tablespoon of fat off of our face every year. So usually it's just a little bit of subtle volume that we need back over time.
So I can look like this?
That's right. There we go. See, perfect.
Yeah. Okay, so what would you do though, real quick? Sculptra?
So things like Sculptra can help, you know, relaxation if you're noticing fine lines, you know, getting on a good skincare program is always really helpful.
Look at, this is after, before, after, before.
You're starting from a great place. So I think, you know, I tell patients it's always nice when I get to start with a really good palette, and it's just doing a little bit of fine tuning.
Okay, obviously that needs to work. Thank you so much.
It's good to see you, Taylor.
I love these tips. Great. Thank you.
Thank you.
I'll see you again next week.